I'm Andrew Allred. I'm Senior Vice President of the Grenza Black-Glier. And I'm here today with Kristen Rozansky, Vice Dean of the Harvard T.H. Chan School of Public Health. So we're going to have a little talk today. But first, I want to officially introduce you to Kristen. She is who I finally know is my first client when I joined GG+A 8 years ago, and has been somebody I've thought highly of through the years. And now it's my pleasure to be working with her again. So at the T.H. Chan School of Public Health. So we've had a good time. We continue to have a good time, but she's got an amazing resume, including Penn State Hershey, Jackson Labs, Columbia Mailman School of Public Health, and she joined Harvard late last year, about 10 months ago, which is almost a year. So I guess it wasn't that late. Kristen, thanks for being with us today. And we look forward to sharing your story of this study that you did. As we get started, I want to remind everybody that we're going to go about 30 minutes. We'll be done by 1:30 Central, I promise. And we welcome any questions from you. We're not in the format to take questions live, but you've got the option to send them in with the QA button at the bottom of the screen. And as soon as you finish with that, Kristen's graciously agreed to address any questions, and we'll get those sent back out to you as soon as we can. In addition, there's a survey. We always love to hear from you for that, so please join us for that. And let me remind everyone that you're on mute, so talk amongst yourselves if you need to. But Kristen, before we really get into this, you want to tell us a little bit about the T.H. Chan School of Public Health and your role there and your team. And we see, this is kind of interesting because I imagine everyone sees the Chan School in almost every newspaper or news article around the world right now. So it's, being in the spotlight has its advantages, I assume. So tell us a little bit about it.
Sure. Okay. Well, first, thank you, Andrew. And it has been a pleasure working with you again. I'm so honored to have been your first client when you started with GG+A, and love having the opportunity to work with you again at the school. And thank you also to everybody who's joining us today for the webinar. It's really, so honored to be invited to participate in this conversation and to share a little bit about our journey at Harvard Chan during this crisis. As Andrew said, we're really very much find ourselves at the center of this. And so, I'm happy to be able to talk about it, and I hope people do ask questions. And I'd also love if people share ideas about what they're doing during this crisis too, because I think this is just the perfect time for us to learn from each other, because there's really just no roadmap for where we all find ourselves today. So so I look forward to that. A little bit about the school. For folks who don't know, so the Harvard Chan School is one of 12 degree granting schools at Harvard University, in addition to the Radcliffe Institute for Advanced Study. In any given year, there's about 20,000 students at Harvard across the spectrum of undergraduate, graduate, and professional studies. And at Harvard Chan, at the School of Public Health, we have about 980 students in any given year. About 1/3 of the students come from outside of the United States. And the school has about 465 faculty, and they sit within one of 9 departments across the School of Public Health. At Harvard University as a whole, each school and many of the centers have their own development teams. Across the entire university, there's about 800 development professionals and development and alumni affairs professionals. And at the School of Public Health, our team, the team that I work with, is made up of 35 individuals. We have what I call a full service shop within the School of Public Health in development, which means that we have a full complement of all the advancement service functions, as well as alumni affairs, and then as well as all the frontline pieces. So we have an annual fund and major gifts and principal gifts and leadership annual gift functions too. I guess to your earlier point, Andrew, it's not an understatement to say that the Harvard Chan School really has been at the center of this global pandemic. Our faculty and our researchers in all these different fields like epidemiology, infectious disease, global health, mental health, food and nutrition, they were all activated very early on in the coronavirus crisis, and they pretty much have been working around the clock since those early days. Our faculty have been advising local and state governments, federal agencies, the White House, governments around the world. One of our faculty members was really excited the one day because he got a call quite out of the blue from the Prime Minister of Israel for his advice. And so it is nice, you know, as well recognized and accomplished as our faculty are, that some things can still really, you know, they can still feel really starstruck by that unexpected call that they get. But our faculty have been just really tapped as advisors and counselors to, you know, the highest level of leaders around the world, essentially, to talk about the effectiveness of interventions, things like social distancing and contact tracing. They've been leaders in expanding testing in Massachusetts and around the country. They're working, we have faculty who are working on the development of vaccines with biomedical companies. We've also been leading the way in developing and deploying mental health resources for first responders, investigating the disproportionate impact of COVID-19 on communities of color, and just, you know, many other things. So we're right in the heart of it. I think it's fair to say. And of course, that's meant for our office, for the Office of External Relations, that we've also found ourselves really at the center of the pandemic. And we have done a whole number of things, which we'll be talking about, to try and address that and respond to that over the past few months, especially since March, when it really became a crisis in the United States.
With all this attention, one might think that fundraising is just dollars are just pouring in, but you know, we in the profession know better. So how actually have your numbers been since the pandemic and having to go remote? We ask everybody this and compare it weekly, but you know, just interesting to note you as well.
Yeah, it has not been easy. So let me start by saying that I share that experience with folks around the world, around the country who work in this profession. We have had some success, though. I would say our third quarter of this year has actually been our strongest quarter to date, and the fourth quarter is actually on pace to exceed our third quarter. So we have gotten traction. Our giving overall this year is up over last year, but it's not been an easy success for sure.
Would you say that's directly related to the pandemic, or just that you were on a upward trend anyway, and this just added to it?
Yeah, thank you. That's a great question. I think we were already on an upward trend this year, even before, I would say going into January of this calendar year of 2020, we were already well up over our giving last year. And there were a number of factors. The office had been going through a lot of transition and rebuilding. And so I think we were just starting to hit our stride. And then, of course, being sort of at the epicenter of the conversation around the pandemic, and working with our colleagues and alumni and donors really has helped catapult us forward. But we were already on an upward trajectory.
That's fantastic. All the way around with that. So what we're here to talk about is a mini campaign or a project campaign for a partnership between Harvard Chan and this, I have to always pause with this, the Human Immunomics Initiative, which HII, as we will refer to it for the rest of the time, which is a study on the immune system for the elderly, which, you know, could lead to a joint vaccine program as well. And the irony with this, all of this was launched pre-pandemic for a future pandemic, but without really knowing that one was imminent. So, you know, but it's working with genetically linked vaccines and all of those things. So tell us a little bit more about the study, the goals, and, you know, what you had hoped to accomplish with this.
Yeah, so the timing was quite interesting. The initiative was launched. It was a partnership between an organization called the Human Vaccine Project and Harvard Chan, and we came together. We had scientists on both sides that, you know, saw this opportunity to really interrogate and better understand the immunologic response, particularly in the elderly, which is a key component to how vaccines work and how effective vaccines are. And this had all been set in motion months ago, about 10 months ago, actually, even before I started at the school. came to fruition in the form of the Human Immunomics Initiative a few months ago, and had a very ambitious fundraising goal as well. So the idea was that we would hope to raise $30 million over the initial 3 years of the initiative, and then $225 million or more over a longer span as the project really got up and running. And so we, I felt it was really important, given that it was a novel idea, that we take some time to investigate whether and how much we could raise for this. These were financial goals that came about as a result of the project planning, the strategic planning for the project, but not, they weren't arrived at through testing of our constituents or really talking to our closest constituents. I think that the importance of doing the study at this moment in time became even more clear as we entered into this pandemic and to the circumstances, because it also gave us a way to connect with our top prospects and donors and really bring them into a very important conversation about an important initiative at a moment in time where we were trying to establish different types of communication mechanisms with them and ways to engage with people as this crisis emerged. So it actually became this opportunity to really engage those closest to us in a very important conversation.
When when working with you, when we realized that what had happened in the world, you're faced with a lot of decisions on your side, one of which was to do this virtually. And we had not done a full virtual campaign at that point, study at that point, but was that a hard decision to make? What did you consider, and your partners with this, how did you go about getting briefed and getting that ready for that?
Mm-hmm. Yeah, I mean, I think the decision wasn't hard. Mapping out what was going to be effective was the hardest part. We knew we needed to do it. And again, saw the upside to it, right? This was a great way to engage our constituents and to get some very valuable information about an important initiative. How to do it when you couldn't pursue some of the traditional mechanisms like leadership briefings and things like that became the question. So what we ended up doing was preparing a draft case statement for the initiative, about the initiative. And we also did a video, a very rough video about featuring some of the scientists who are the core faculty working on the initiative, and really relied on that to be the mechanism to educate our constituents about what the initiative was going to be, what it could look like, what the impact might be, why it's a priority. And so we used that as a way to inform people, and then went ahead with the kind of traditional interviews post information sharing.
So let's go back to that information sharing.
Mm-hmm.
And a lot of people who've done any kind of study like this know that the pre-interview work that your team or any team has to do with donors or prospects is a ton of work.
Yeah.
So how did you prepare your team to do that, and what exactly did you do to do that?
Yeah. So we, thank you. We did spend a good deal of time. First of all, we identified a core team that would really be responsible for this work stream for this project. We had them get to know the faculty, to just spend time to better understand the initiative themselves. We went through many iterations of identifying who the right people were to consider for participants in this project. We then had worked out with GG+A a whole process for how we would go about communicating, and the steps to communicate to both inform people about the initiative, to then follow up with a phone call to answer questions they might have. So we provided multiple mechanisms along the way, from emails to personal calls, to the information we shared, that all led up to ultimately the interviews that took place.
And how did your donors or prospects respond to that? Because most of the ones, I assume, had been interviewed prior for various studies at either Harvard or other places. So this was a new thing for them as well. Did they pivot like the rest of the world needed to at that point?
Yeah, I very much so. I think they, we chose people for the study as typically you would want to do, who are, considered to be kind of insiders, right? They're people who've already invested in the school financially. They had the capability, the capacity to support this particular initiative financially. But they, they're already invested in us, in the school, and what we do. And I think, really pivoted well to this. I mean, we did get some useful feedback. I think for some people, they would have liked, and I think going forward would like more of a dialogue and a conversation with leadership of the institution. So that was really helpful feedback that we garnered. But I think they all pivoted, and so many people jumped on board. We were actually quite surprised with how willing people were. I guess it speaks to, we're all at home right now. So we actually had a really good participation rate.
I will say, of all the studies I've ever done, the scheduling was probably the absolute best, easiest ever, because timing wise, to fill everybody in, it was during that first 2 weeks of the pandemic when nobody was moving anywhere.
Yeah.
So we were able to catch everybody, and it was a really nice example with that. Let's talk about the video though. So the video, had some positive and negatives to it, just because of the quickness, and the videographers and everyone were also working out of their homes. So it had a little rough element to it. We all admit that.
It did.
But do you think that was an equal replacement to a leadership briefing? For future studies, future things, would you do that again? Or do you think that face-to-face briefing with especially your top interviewees is probably better?
I think, yeah, it was a great question, because some people did, got really focused on the fact that it was this rough video, and it wasn't this polished piece. And but I think for a study like this, which was about a particular initiative, this wasn't a comprehensive campaign, that feasibility study for a comprehensive campaign. I do think the video was an effective way to go. I would probably add on, if I had it all to do over again, I would add on a step where we had leadership of the institution or a key volunteer also call and have some one-on-one conversations with, a handful of our top volunteers, or honestly, maybe some of our volunteers and donors who are not as tech savvy.
We should note though, we had a time limit to get this one done. And during the first 2 weeks, the leadership were they were kind of extremely busy. So the roughness was doing what we could do in that situation. I know you've worked on some pretty complex studies in the past as well, but this being a less complex project may have added to this, but what did you see as the benefit of this style, of the completely virtual style?
I think it was easier to complete, certainly, and it was less expensive to to do overall. So I think the cost savings, the efficiencies of it, really worked beautifully for a small type of study like this, to really kick the tires on this initiative. And so I would do it again in heartbeat, maybe with a little tweaks around the edges, and maybe a little more refined video. But as you said, we were kind of rolling with it. And one of the things you can't always anticipate, especially during a crisis, is that the leadership of the School of Public Health might be kind of busy and not not really be available for some of the fundraising things. And so but other than doing the video a little bit differently, I think I would absolutely do this again for a smaller type of initiative. It was effective. It was efficient. We got great feedback to build upon. We got great feedback from the participants.
Well, speaking of that, anybody who's ever done one of these studies, despite what they tell me, I know secretly they're just hoping that 100% of the people come back saying it's the best thing they've ever heard about ever, which, we know that doesn't really happen. Full disclosure, the final report has not been seen by the administration and leadership, so we can't go completely announce everything with that. But can you tell us anything about the preliminary results you've seen? And, I guess I should ask you, did your secret wish come true with that?
No, absolutely not. And I did try to prepare the team because I have been through this before. And, I know my own experience that you really hope that everybody's going to come back and say, this is the best idea ever. And I could not think of an additional word that you could add to that case statement. Let's just make it more compelling. But that never happens. And it didn't happen here. And I think, but we got great feedback, very concrete feedback from our constituents about questions that we need to interrogate further, things we need to explain better. And I think just, beyond that, I think one of the benefits that we didn't anticipate was it really gave us some great insights into how our donors, our sort of most significant donors, are thinking about their own giving right now, how they're thinking about their future giving to the school, and how they're just kind of feeling about the state of the world. One of the things that was a little surprising for me, but I've heard this from other colleagues, is that even donors who invest typically in research, right? So they're, they get that this is a long-term investment. Even those types of donors who participated in the study really demonstrated to me that they are very focused on the here and the now and the impact of the moment. And so, it was a little hard, I think, for some of the constituents to really get behind an initiative where we're talking about either a population they didn't necessarily feel that they related to, which is the elderly, or a vaccine sometime in the future, right? So they're very, very focused on what vaccine is going to be available for COVID-19 that will benefit my family and I right now. And so it was this interesting way of thinking that I hadn't anticipated coming out of the study, but fabulous information to know and build upon for just our fundraising as a whole.
Overall, do you think doing this in the time of COVID-19, which again wasn't our initial choice, but doing this during that thing, do you think that hurt or helped awareness of vaccines, awareness of the importance of this, and especially being one, to look specifically at the elderly population and how genetic vaccines can help them in the future?
Mm-hmm.
Do you think all of that was more, people were more top of mind? I know what you just said, but
mm-hmm.
plus or minus on the overall,
mm-hmm.
was the timing good or bad?
Well, I think the timing was good. Certainly from the standpoint, as we touched on earlier, that people were a captive audience. Great timing. So I think that worked really well. And I do think that, it was a topic that's just, it's on people's minds, and maybe under different circumstances, this particular initiative would have landed differently with people. So in that sense, yeah, maybe it's not an ideal time, but I think that's why you do these studies, right? So that you can really, there's always things happening, right, and around us and in the kind of larger world that shape people's thinking about their philanthropy, and I think that it was just quite helpful for us to do it at this moment in time and really get a sense of where people's heads are and what they're thinking. So I'm so grateful that we did it. I think it's great data that we've collected, and very, very promising for, maybe not so much for this initiative itself, but just overall.
So how, now that this is wrapping up and the pandemic's still raging, what's next for the school? What's the next priority for fundraising, and how are you equipping your team to deal with that? Because, unlike a lot of the people we talk to every day, they're off over here. When I talk to your gift officers, some people really think that they're going to change everything. And, there's a lot of pressure being a school of public health, especially with a name like Harvard. So how are you preparing your team to go forward and take this knowledge and all of these things that they're learning to garner gifts and to bring in ultimately increased dollars more?
Mm-hmm. Yeah, so we, I think we've really tried to build in thoughtful analysis of what we're learning as we go along. And, fortunately, early on in the pandemic, we really, did a few things. So we committed to, we're going to communicate with our constituents. We're going to open up more lines of communications with our constituents. We're going to communicate really what our faculty are doing and communicate the facts to our constituents. And, we sort of mapped out what we wanted to accomplish over the next few months. And I think we're at a point now where we've been able to step back and say, these things that we deployed were successful, and we want to continue them, and we want to build on these going forward. So some of the things that have come out of this pandemic have really, during this time of the pandemic, have really shaped how we're going to go forward with our fundraising. So we've dramatically increased communications with our constituents. We have a new weekly newsletter. We've increased our sort of social media presence. We've done a lot of virtual engagement with prospects and introducing them to, their scholarship recipients, for example. And those are things that have been incredibly well received, and we're definitely going to incorporate them into our future planning and activities. For us, we're, the pandemic is still raging. We're still raising money for COVID-19 related work. We're also very, very involved and really looking closely at the work that the school does in racial equality, and really putting together some materials and messaging around what the school is doing there and how people can invest in the school to help advance efforts around health equalities, reduce racial disparities, increase equity and justice. So we've been doing a lot of work on that in the past few weeks too.
So I promised everybody we'd be 30 minutes, so we're getting very close. So I will officially close it out in just a second, and by reminding everyone to visit the chat function to fill out the survey. But last words from you, Kristen. What advice would you give others who are sort of facing this, or even considering surveying their donors to see how they are feeling about this? What's your advice to people facing projects like this right now?
Mm-hmm. So I actually, we were really fortunate early on in this experience. We did a town hall, and we invited a faculty member from the business school to join with our faculty from the Harvard Chan School to talk about the COVID response. And this faculty member, Willie, she used this wonderful phrase called "forged in crisis." And he was talking about different responses to what's happening today. And I love that. And it's just stuck with me. And I think, my advice to everybody is to really look at the opportunities, that come out of this moment in time, and those opportunities that are forged in crisis, but have great potential going forward. We really, I think, embraced an approach at the school of, throwing a lot at the wall and seeing what would stick. And I think that you just have to be fearless during this time when it's really, you really want to do quite the opposite, and just, kind of stick with what you know. And I think this is a time where you can really, you can't over communicate with people. That's definitely a lesson that I've learned. And it's a time to try new things and really be pretty brave and courageous. Not be afraid to ask people for money, not assume to answer the question for our donors of what they're thinking and what they might give or not give. We really had to make a commitment to just go forward and kind of ask with confidence. And I think the results have been proven out from that. So yeah, I think it's, there's a silver lining to a, very, very difficult, terrible time. And we all have to seek that out and find it to improve our work and where we go next.
I think your words "be brave" are perfect, because that's a great way to end this. So thank you everyone for joining us today. And thank you, Kristen, especially for doing this. Please fill out the survey when you can. And in Kristen's words, be brave.
Thanks, Andrew.
Thank you.